Well, good morning, Queensland. We've just had our daily COVID briefing with the Premier. We can advise that there are 19 new cases of COVID-19 in Queensland in the last 24 hours, 16 of them locally acquired and linked to the Indooroopilly Delta cluster. That's 4 cases linked to Ironside State School, including 1 teacher, 2 cases linked to Indooroopilly State High School, 1 case linked to Brisbane Boys Grammar, and 9 cases that are close contacts or family members of cases already identified in the cluster. That brings this outbreak to 63 genomically linked cases, meaning that in less than a week, this has become our biggest outbreak since the first wave last year. There is 1 new case locally acquired with the source of infection under investigation. That's the Cairns case that has been reported. It's confirmed to be the Delta strain, but is not linked to the current outbreak in Brisbane. The reef pilot was vaccinated, as are all of our reef pilots, which of course is very good, but we will be continuing to ramp up testing in Cairns in order to ensure there's been no further transmission there. The other 2 cases were overseas acquired and detected in hotel quarantine. That brings total number of cases to 1,859. 100 of those are active. We didn't just break our testing record yesterday, we smashed it, which is a fantastic result, Queenslanders. Our previous record was 35,357 tests. In the last 24-hour period, we tested 51,479 samples, breaking past that record, breaking past that goal that the Chief Health Officer set for us. And so let's keep it up, Queensland. Let's keep that testing rate high. That's one of the things that will allow us to get out of lockdown as quickly as possible. We now have 5,844 people, at least 5,844 people subject to home quarantine directions, 9,598 people in total in quarantine, and we expect those numbers are actually higher. And so I want to thank everyone from Noosa and the Sunshine Coast to the Gold Coast and all 11 LGAs. The data that we're receiving is suggesting that people are complying with this lockdown by and large. Traffic data, public transport data, and the police data from their random intercepts has all indicated a reduction in the number of people moving around the region, and that means a reduction in the risk of the virus moving around the region. We are still seeing some people going out to shop or to browse for non-essential reasons, and while there is an exemption to allow people to leave their homes to get essential groceries and medicines, that does not extend to other discretionary items. It has to be essential, and the onus is on the individual to have a reason to leave their home, not on retailers or businesses. Now is not the time to buy outdoor furniture. There will be time before summer to get sun lounges. And I just remind everyone that the law, the health directions and the law set a minimum requirement, but like most things, we expect people to operate at a level above what is the bare minimum legal requirement. And so I urge everybody, again, to consider whether the reason they are leaving their home is absolutely essential, and if it's not, please put it off. We hope that this is just 5 more days, but every time someone leaves their home, they increase the risk that this lockdown may need to go on longer. We are, though, starting to see some early signs that the lockdown is working. We know, for example, that 2 of the cases we're reporting today had 0 days infectious in the community, meaning that there's no risk that they have infected other people not in quarantine. And that's ultimately what this lockdown is about, getting to the point where we are confident that nobody who is confirmed as positive could have infected others who are not in quarantine. While it's not in our immediate frame of concern, we continue to monitor the situation in other states. New South Wales is beginning to report transmission outside of Sydney, including as far north as Coffs Harbour, but not yet in the border zone. I understand Victoria is now recording 0 cases, which is a fantastic result for them. Of course, that's great news, and we hope to be there here in Queensland as soon as we possibly can. With the ECA cancelled, and the likelihood that we will still see some restrictions in Brisbane next week, we've made the decision to cancel the Brisbane ECA public holiday on Wednesday. It will be rescheduled to sometime later in the year. We've not yet determined when. Last year, when we delayed the public holiday to create a new special long weekend, we saw Queenslanders flock to tourist destinations, spending money in our hospitality businesses, and so we'd hope to create a similar opportunity again for Queenslanders to support our local tourism operators and local hospitality businesses. We'll have more to say about that as that decision is being made. We can cancel the holiday by regulation, so we've gone ahead and done that. To create the new rescheduled holiday, we'll need to go to Parliament and pass legislation, and so that won't be able to happen until the end of August at the earliest.
Thank you, Deputy Premier. So 16 new cases out in the community related to this new Delta cluster based at Indooroopilly. So we now have 63 cases in total related to that cluster. Then we have that pilot who works up in the Cairns area guiding ships through the reef. He's a confirmed case. And then we have 2 overseas acquired cases, both in hotel quarantine. And now we have 100 active cases, so that's the most we've had in Queensland since last year's initial outbreaks. The good news, though, is of those 16 new cases related to the Indooroopilly Delta outbreak, 2 were in quarantine for their entire infectious period. 1 had 1 day out in the community. So that was during the lockdown period, so hopefully no one else was out there interacting with them. Then another person for 2 days, another person for 3 days, then 1 person for 5 days. So there will be more exposure venues going up on our website. So it is really important for anyone who lives in those 11 LGAs or who has been in those 11 LGAs in the last week to just check that you haven't been to an exposure venue, and just check every single day that there haven't been more added. The other 10 we're still working through, because here in Queensland my cut-off for when I declare numbers is 6 a.m. in the morning. So some of these were coming through during the night and I was seeing them through the night, and we don't have that information from those individuals. So that's why I can't tell you about those other 10, but of course it's all being worked on now, and as soon as we get any exposure venues related to any of those 16 people, we'll put them up on our website, so please check that, and we'll put a press release out later today. So you've heard that today's cases were again related to the Ironside State School, Indooroopilly State High. Then the remainder were all related to known cases that have been to numerous different schools that we already know about. 7 of them were family, household members, and 3 were close contacts. So we haven't got any unlinked cases due to those 16 new cases today, which is good. Now, I'm getting more confident that we don't have other chains of transmission out there that I don't know about because of the fantastic testing. 51,000 is an absolutely brilliant result. Thank you to every single person who came forward and got tested. I know that in some places there were long queues, but it is so important that you do that, because we still don't have the link between that initial family of 5 and those 2 very initial cases from the 29th of June that came from overseas, other than the whole genome sequence. So we still need to keep up that testing. Any symptoms at all, please immediately come forward and get tested. That is absolutely critical. Now, the pilot from Cairns, he was fully vaccinated with 2 doses of Pfizer back in March. So all of our pilots who go onto vessels that they pilot into our waters here in Queensland have been vaccinated. Maritime Safety Queensland did a superb job doing that because we know they were all high risk, and this proves it. So he has acquired the Delta variant, most likely from one of those ships. So I just this morning got the whole genome sequence result back from him. It's confirmed Delta. It is not the Delta strain that is circulating in Brisbane, and it hasn't clustered with any other known case of Delta in Queensland. So now those whole genome sequence experts will go and see whether it clusters with any other case in Australia or overseas. But it's highly likely he's acquired this infection while he's been about his work piloting one of those ships. So he has very high CT values, extremely high, so that means very little virus. His family members who live in the same household as him, his partner and child, are negative, but he did take his child to a childcare centre, so that's why the childcare centre his child attends has been closed while they clean it and assess the risk there. And we've stood up a lot of additional clinics in that Cairns area, and I ask anyone who lives anywhere in that Cairns area to please look online for exposure sites, and if you have any symptoms at all, please immediately come forward and get tested. That is critical, because although I believe the risk is low, it is not zero. There is still risk there that he could have transmitted the infection. But he is fully vaccinated, and the CT values on the tests that have been done are high, so there's only a small amount of virus there, but there was enough virus to sequence. So there is enough virus there to infect someone. So that's very important. Thank you for that. So going forward, we really have a challenge here as Queenslanders, which I know we're up to, but I need your help. So I'm not a lawyer, and I've got a really good team who write directions, but of course there are gaps in those directions. I need every single person who lives in the 11 LGAs, instead of reading a direction and working out what they might be able to do under that direction, instead, when you open your front door, could you please think, do I really need to go outside my front door today? Maybe just stay home, because you can only move this virus around if the person moves around. We know that fomite transmission is very low risk. It's people that move this virus. So if you can manage to stay home, then hopefully we will be able to lift those restrictions, those stay-at-home requirements at 4 p.m. on Sunday. So I'm sure no one who lives in those 11 LGAs want to be the person that means we have to continue those restrictions beyond 4 p.m. on Sunday. So please, when you open your front door, just think for a moment, do you really need to go out? And also, and I'm a great online shopper, could you think about whether you need to do online shopping this week? Do you need those people out in the community delivering packages and things? Maybe just leave them for a week. And click and collect. Do you really need that furniture that I know you can go and click and collect, which is safer, absolutely, than going into the store, but it still means you're putting someone else at risk. So please, everyone, just think of what you could do to just stay at home for the next few days until Sunday, because it'd be really good if we could lift it. That's a big challenge, though, when I look at other states and how long it's taken before they could lift their restrictions. If we don't do something really, really, really special in Queensland, we'll be extending the lockdown. So please, I ask of all of you, try your absolute hardest to stay at home if you possibly can. Of course, if you need food, go out and buy it, of course. And our supermarkets are brilliant and have systems in place, and check in, do all of those things. So this is not about you don't go out for essential goods. Of course, go out for essential goods. But if it doesn't matter, genuinely, you can wait to buy that thing till next week. Just leave it and let's see where we are on Sunday and make some more decisions then about the necessity of whatever it is. So let's go all out this week. Now, of course, there are some exceptions. If you're sick, come forward immediately and get tested. That is critical. The more testing, and thank you, those 51,000 people yesterday, just brilliant. So the more testing, and we can find cases then while we're in lockdown. That's my aim. Find any case today that we've got people in lockdown, because then it doesn't matter we've had those cases because they're in quarantine. So it won't stop us lifting the restrictions on Sunday. So please, everyone, just think of what you can do in the next few days so we can lift this and we can beat all the predictions about how long it takes to get such a large cluster under control. Thank you.
Firstly, a huge thank you to the 51,479 people coming forward getting tests. That is incredible. We want to see those numbers stay high over the next few days. For people coming out and getting vaccinated, if you have a booking, please continue to go to that booking and get your vaccination unless you are unwell. And of course, for those people in home quarantine now, 5,844 people, at least that number, are home quarantining right now. So if you know someone who's home quarantining, check that they're okay, give them a call, send them a text, make sure that they're ringing our 134 COVID number if they need any support whatsoever, because they must stay home other than to go get tested. We are at 63 for this cluster, the highest we've had since the first wave last year, and we're up to 100 active cases. So the next 5 days, it's up to you. Whether we extend this lockdown, whether we spread the virus to the community, that is up to each and every one of us. As Dr. Young says, don't worry about what the directives and the law says. Do you want to go out and risk getting the virus and bringing it back to your household and risk an extension of the lockdown? If we do this and we do it right over the next 5 days, it can make all the difference. And we can see Queensland coming out of a lockdown sooner than other states if we do this right over the next 5 days. So even if you are ordering stuff online, if that means someone's going to have to come to your household to deliver that, to bring stuff into your household, then if it's not essential, absolutely essential, just hold off a few days. I want to also say we've set up a number of clinics in Cairns. So for those watching and listening from Cairns today, we have Queensland Health Clinics at the Cairns Hospital and Uramula Street. They're drive-throughs. They're extended from today from 6:30 in the morning till 10 o'clock tonight and tomorrow night, and then we'll see how we go from there. There's 9 clinics, testing clinics that are being run by Cairns and Hinterland Hospital and Health Service, and there's another 20 private testing clinics also in Cairns and surrounding areas. QML are setting up a pop-up clinic opposite the Cairns Hospital today from 10 a.m. for walk-ins as well, and there's an additional private clinic at the Childcare Centre at Trinity Beach operating from 9 to 4 today. Those are for the families who are linked with that childcare centre. So please check our sites for updates and extensions to hours for sites. The new the Mogul Sports Park is open today as well. So check our website for new testing clinics, and also if you've been in those 11 LGAs or in the Cairns area, please keep checking our website for exposure sites. I'm pleased to say that I'm aware that the Pharmacy Guilds advised that 224 of their over 500 pharmacists that are seeking approval to deliver vaccines in southeast Queensland have now been authorised by the Commonwealth and have put their orders in. I'm being advised that they've been told that the supplies they need, so the consumables, the syringes and so forth, and the vaccine itself will be coming next week. Now, I will be doing everything possible to fast track that. The Commonwealth has got these vaccines already. They offered them. a couple of days ago. So we would hope that that 150,000 vaccines can arrive earlier than next week. And we will look at our own AZ supply and if we can redirect that to those 224 pharmacies that have approval now, and our consumables, we will do that as well. But I don't think it's acceptable that they have to wait till next week for the Commonwealth to deliver those vaccines and those consumables when they've got it in supply now, and we ask that they be delivered as soon as possible, because the sooner we start getting these vaccines in people's arms, the safer those individuals become and the safer our community becomes. Thank you.
Thank you. I will also start with a thank you to our community for the past 24 hours. We have seen a good increase in compliance right across the community. Our enforcement's down, the calls for service have been down, but nonetheless the request is still there to do better. We still are having to take too much action that we would rather not take. Yesterday we issued 48 penalty infringement notices, and that included 7 for masks and 34 for general non-compliance with the directions in terms of being out in the community when people did not have a valid reason. We also arrested 4 persons. Regrettably, these characters decided to do a break and enter at Heritage Park as well as disobeying the directions, so they've been charged with criminal offences and breaches of the health directions. We instigated our operation yesterday of increased police visibility across the southeast corner, and that included RBT-style intercepts. They will continue. We will monitor how they are tracking and increase them if we need to. I can tell you that from a sampling that we've done in some of them, for instance, 150 vehicles stopped at one on our south side, all 150 people were compliant with the directions and within the 10 k's as required of those directions, which is very encouraging. But as you've already heard this morning, it's not just about whether we can legally do it, it's about whether we should be out there. So clearly for the community, it's not just making sure that you're doing the lawful thing, make sure you are doing the right thing and only go out if you need to do that. Yesterday we also inspected 62 businesses and all were compliant. I'm going to finish off by saying thank you to the community that does alert us to these issues. We need to hear from you if there are concerns. This is not something that the police can do alone, and we do rely on the community supporting in this, and thank them for that. Thank you.
On those rules, obviously we've seen a lot of people going out to stores and buying hot plants and things like that, sunlounges as you mentioned. If people are going to keep on doing that, will you consider implementing new rules?
The rules are pretty strict, and they require individuals to consider before they leave home whether they are leaving for one of those essential reasons. And that's the only reason you can continue to be out of the home. So you can't go out because you need milk, but stop to look at EB Games or JB Hi-Fi. So the requirements are there. The police are checking people for the first time, those RBT-style interceptions. We just urge everyone to really, just for a few more days, we hope, do the right thing. 5 more days, do the right thing, and then next week you can buy all the sun lounges you think you need.
Will the government actually clarify though what is an essential worker? Because there seems to be a lot of confusion around what is an essential worker, especially in retail.
Look, I'd certainly urge those businesses to reflect on how much of what they sell could be considered essential, and then take that into account. But really, the way we've implemented these restrictions right throughout the pandemic has been to put the onus on the individual to only be able to leave for those essential reasons, and that's what police are focused on enforcing.
There's a movie crew that's actually gone over to Stradbroke Island during the hard lockdown. Do you consider that essential?
Look, I'm not across the details of that. I might check with the Chief Health Officer if you're aware of. Not aware of those details, but happy if you pass them on, we can look into it. Thank you.
Given the cases today, how are you feeling about that outcome?
I'm confident that if Queenslanders continue what they've been doing and just ramp it up a little bit, that we can get this under control by Sunday. So the amount of testing is very, very reassuring. Please continue doing that. And the fact that most people are staying at home. The data about car movements, about public transport, looking around at our communities suggests most people are staying at home. I'd just like people to reflect a little bit more about, is it essential? Because last year I didn't have any problems with Bunnings being open and people going and buying pot plants and doing some gardening, but that was with previous variants. We just need to ramp it up. This is Delta. It's so much more contagious that really we've just got to, as I say, ramp it up and really for the next 5 days think, do I really need to leave the house?
There are a couple of exposure sites on the Gold Coast. Is there a concern about the Gold Coast, and what's the link to those exposure sites to the cluster of Brisbane?
Oh yes, so they're related to our kids and our outbreaks here. All of our 63 cases to date are linked, and they've all been within the 11 LGAs. So I don't think we need to extend our stay-at-home orders at this stage beyond those 11 LGAs.
Dr. Young, just on the 100 active cases, what sort of pressure is that putting on the hospital system, and what's being done to ease that, given you said that's the highest number since last year's outbreak?
So we've implemented our hospital in the home model again. So we had that in place last year. So we're now assessing the people who become sick, and we're assessing the home they're within, and where it's safe for both that individual who's unwell and for the other people in the home, we're getting them to be managed at home with virtual care.
Can you lift lockdown on Sunday if we don't have that missing link detected?
Yes, if we continue testing. So if we continue this 50,000 tests a day, I'll then be confident that we haven't got any chains of transmission happening out there that I don't know about. So that's why it's critical. Anyone who's unwell, it doesn't matter how mild your symptoms are, anywhere in those 11 LGAs, it is absolutely critical, if we can lift on Sunday, that I need you to get tested, because I need big testing numbers.
Dr. Young, is it entirely possible that we may never find the missing link for this cluster? And if not, why not?
Yes, it is entirely possible. We'll never find the link between one of those two cases that came into Queensland on the 29th of June and this family of 5. It's very possible we'll never find that link, because it could have been someone who got infected at the airport or in hotel quarantine or in the hospital or in the community, and they could be one of that 20% who doesn't get symptoms, and just because you don't get symptoms doesn't mean that you can't pass it on. So they could then have passed it on to one of that family of 5 or to someone else who passed it on to the family of 5. So yes, it's absolutely possible we'll never find the missing link.
And Dr. Young, how are you feeling about the Sunshine Coast and how big Bruce was tested there yesterday? Do you have an update on how many have been tested and what their results are?
I haven't got an update of how many of those children so far have been tested and their results, but of course, if any of them were positive, I would have been told immediately.
The number of health staff in quarantine, is that impacting the delivery of COVID vaccines or not?
No, because we are prioritising delivery of the vaccine. That is critical. We are prioritising our testing sites, and we are prioritising treatment of people with COVID, and then anything else that can be delayed, we are delaying.
Dr. Young, a question from the Gold Coast about the border zone. Some concerns from residents that New South Wales Health has put a new notice. So there's a new order, so any resident who's been in South East Queensland has to go into lockdown for 14 days if they're from northern New South Wales. They cannot technically cross the border for work. Can you explain what that means to people?
You need to ask New South Wales. So New South Wales has put in requirements to keep their residents in the border zone safe from getting infected in Queensland and taking that infection back to New South Wales. But the specifics of it, I think you should ask New South Wales about. I, of course, support what New South Wales is doing.
Are you worried at all about the ability of contact tracers to keep up? I've heard a few instances, for example, a woman who went to the auditorium at Brisbane Girls Grammar School, she wasn't contacted until yesterday through the app. She's been hearing information through the media and through her neighbours. Are you worried about contact tracers' ability to be able to keep up with so many exposure sites?
No, I'm not. They're working very hard, and also people like that example you've given are doing what I ask every single day, which is I need every single person who has been in Brisbane in the last week at least to go online once a day, pick a time, that's convenient to you, the same time every day, and check every single exposure venue. And when it comes on each day, there's a new, so you can see the new ones if you check the day before, and check that you haven't been there. And if you've been there, then you need to contact us. And thousands of people have done it. And I'm so grateful to you. So thousands and thousands of Queenslanders have gone online, seen that they've been in an exposure venue here in Brisbane, or indeed in Adelaide or Melbourne, and they've contacted us through the portal. Now, not everyone has the IT knowledge to be able to use that portal, so you can, if you can't use the portal to contact us, then ring 134 COVID or 13 Health if you don't know the 134 COVID line, and ring us. But the vast majority of people have been working it out for themselves, and that's why time and time again we do so well in Queensland. So I'm very grateful. Now, at the same time as you are doing all that to help us out, we are also going through and doing the contact tracing. But time and time again, people are being called and said, yep, that person was aware, they've got themselves in quarantine. Beautiful. So it's about us all working together. We can't do this alone, Queensland Health, and you can't do it alone, but together we can definitely do it. So thank you very much.
Just a question for the Deputy Commissioner. I don't know if you've seen online, there was a video that went a bit viral yesterday of a man being arrested in the Botanical Gardens, and he appeared to have a medical incident. Can you explain what happened there in the background behind?
Yeah, I don't have all the facts, but I do understand that this gentleman was approached because he was not wearing a mask. So in the interaction between police and he suffered some sort of episode. Ambulance were called, he was given treatment, and actually my understanding was that they could not find any issues with him. Then he was taken away. We'll investigate that in terms of any breach that he had. So no action's been taken at this stage.
Seen the video? Was it a bit?
No, I haven't seen the video.
On the extra.
Yeah, so I've received a brief on that. Basically, the understanding I have of is that these people came into our state and were in Roma for a number of days. They then self-declared to health that they'd come in. Police were tasked with that. They were given advice to remain isolated. They were then issued with a direction as per quarantines, which we've already discussed around coming to Brisbane and quarantining there. The investigations of the police disclosed that they had initially denied coming out of a hotspot, but had in fact come out of a hotspot, which was a breach. So they have been issued with a penalty infringement notice for that, and the evidence exists that that's what was required for that. All the other matters then, of course, of what's happened in the quarantine stuff, I don't have all the details on that, but I'm satisfied the police actions are appropriate.
On the extra resources you're throwing at these RBT
Sure.
style patrols, how many officers do you have involved in that operation?
We have many thousands of police officers in Brisbane, but what we've done is augment them with several hundred, so up to 300 police out of our specialised areas and office jobs. So they're out on the front line with their frontline colleagues, helping them to interface with our community and make sure they're doing the right thing.
And is that a day-by-day thing?
Yeah, we're running, and what we're doing is also planning a need to escalate that if we should, and this is all based around the numbers that we start to see in terms of if there's further outbreaks, or indeed if we see increasing non-compliance. And of course what we've seen in the last 24 hours is an improvement in compliance, which is exactly where we want to go.
Just quickly, can you just detail how hospitals are dealing with so many staff in quarantine? Have all elective surgeries been cancelled, and what measures are being put in place?
So not all surgery, that is decided at individual HHS levels based on what their demands are and the number of staff. For example, I know Metro North have I think 200 at least health workers that are our close contacts. As Dr. Young has said, what we have done is made sure that we have repurposed the staff that are available to focus on our core areas, looking after people who are sick with COVID, obviously looking after anyone in an emergency situation and our most seriously ill people, and also concentrating on testing and vaccination. These numbers alone for testing means we need a lot of staff, and I want to thank not just those in the public health system. We have a lot of private pathologists helping us as well. So they're running our actual testing clinics, and of course they're doing the testing as well. So I just do want to give a shout out for Pathology Queensland and all of the pathologists and the work that's happening there. Queensland Ambulance Service is working with us as well. So QAS is standing up some of our pop-up clinics as they have whenever we've had an outbreak in the community, and we're calling across other agencies where they're not clinical roles, but they're admin roles and other roles, crowd management, for testing and vaccinations. We're calling on other agencies to also help us as well, so we can free up health workers to concentrate in those areas where they're needed. But there is pressure on the system. When you get a situation like this, not just the pressure of 100 active cases and thousands of close contacts and thousands of people in home quarantine, you also end up with health professionals who are close contacts. It puts strain on the system, but I know that our staff have trained for this, they're prepared for it, they know what to do, and I just hope that all of our health workers stay safe, because what I don't want to see is what we've seen overseas with the number of health workers being infected and very serious outcomes. So I hope all of our health workers are well. And if for no other reason, when you walk to that front door and decide whether you want to go outside or not, think of a health worker. Think of a health worker. Stay home for them. That way you can keep our health workers safe.
When do you expect to hear about that extra stock of AstraZeneca?
So, Greg Hunt, I'll be honest, I found out about the 150,000 offer of AstraZeneca through the media. I will be writing to Greg Hunt today to ask that the 150,000 goes directly to the pharmacies and not come to us to distribute, so that it can get to them quicker. I've only just found out overnight that the orders that have been put in by the pharmacists, what they've got back is information that the consumables and the vaccine will arrive next week sometime. So they don't even have a date, just next week sometime. So if Greg Hunt says they've got 150,000 now, which I have no doubt they do of AstraZeneca, then it should be on trucks today. It should be getting on trucks today. 224 pharmacists were approved yesterday to start putting needles in arms. So the trucks should be on their way today with the consumables and the vaccine. In the meantime, we will look at any supply we've got in southeast Queensland that we can redirect to those pharmacists, and our supplies as well, but we need to make sure that we've got adequate supplies for our own vaccination centres as the vaccines ramp up over the coming weeks. We've also written to the Commonwealth to see if we can bring any of our August supply forward. So we are due to get about 84,000 Pfizer a week, each week of August, and we want it brought forward if it's available. Should already be here. So can we bring it forward and start using it now in our vaccination clinics? Sorry?
Just on some of the regional vaccines that came out yesterday, are you concerned about some of these areas particularly up?
Look, we want everyone to come out and get vaccinated, and I'm really keen to work with these communities about what else we can do to get people coming forward for these vaccines. We still have some fantastic results. I've publicly said before, Central West Hospital and Health Service has done an incredible job with their outreach and gone into regional communities and vaccinated everyone who's eligible. And so we really do want everyone, no matter where they live. You can't assume that if you haven't seen any cases in your community to date that it can't happen. Cairns is another reminder that we can have a positive case anywhere in Queensland. This is a global pandemic. It's not just for southeast Queensland. And so everyone needs to get vaccinated, because we need everyone vaccinated at that high level to be able to open up the whole of Queensland. We don't want to just open up the economy in Brisbane and in southeast Queensland. We want to open up the whole state's economy. The best way to do that is to vaccinate the whole state. Now, Dr. Young has had amazing results with immunising children in this state. 95%. So there's no reason why we shouldn't have at least 95% of the Queensland population who's eligible vaccinated once all the vaccine is here in the country.
Do you know why vaccination had the heart surgery when the doctor was put out of quarantine? Has there been any other instances of that where medical staff have been...
No. No.
And do you know why vaccination rates in Logan and Ipswich are so low?
Look, we will continue. We do a lot of consumer advocacy and reach out to find out why it is that we, have a vaccine hesitancy or why we not be coming forward. We need to break down the data as to whether it's AstraZeneca or Pfizer, the age groups. We have seen pretty consistent sort of numbers across the state in Pfizer and vaccine, but we want to have a look at those numbers a little bit closer. We need to look at language issues. We have been really, really strong, and I think led the country, and Dr. Young has said this to me, led the country in the way we've embraced and engaged with our multicultural communities. So we want to do that not just in testing and messaging around staying at home, but also about vaccinations. So we'll continue to work with all sectors of the community and to get that message out to come forward. Of course, we've got to have the vaccine. So we have been concentrating our messaging on 60 plus because that's where we have the vaccine. We don't have spare Pfizer. There is no point me racing out into these communities saying, quick, go get Pfizer. It's not there. If you've got a booking or you're getting a second dose or your front line, that's our priority areas for Pfizer. As soon as the Commonwealth says they can get more into this country, then we are ready. We are setting up the clinics. We are ready to expand. We cannot wait to get this vaccine into this state and ramp up into very significant numbers to get as many people vaccinated as quickly as possible.
Minister, the National Retailers Association tells me that they've been consulted on what constitutes essential retail stores and what doesn't. Is the government working on a list?
Look, the retailers have provided us a list, but the problem is that it is very, very difficult to have a definitive list of what can and can't open. We have always, since the start of the pandemic, concentrated on non-essential business being those that we know are the greatest risk. So our cafes and restaurants, licensed venues, where people are sitting for prolonged time and circulating, and we know we have seen a lot of transmission in those areas. Now, when it comes to retail stores, the fact is that a number of those retail stores still sell essential items within those stores. It might be nappies, it might be baby formula, it may be electronics, computers, so that people can do work at home or their children can study at home. So it's very hard to have a definitive, absolute list of what should and shouldn't open. But the message cannot be clearer. It's up to you. Is it essential for you to walk out that door and go to that shop? Do you really need that item in the next 5 days? Is it worth risking getting the virus and spreading it back in your household? Is it worth an extended lockdown just to get that extra item? If the answer's no, stay home. It's that simple. Thank you.
Yes, please. Yes. Thanks, Minister. Just how's the remote learning going so far?
Remote learning.
Any movement on what will happen with exams?
Yes, remote learning's going very well. We've got more than enough capacity and everyone is undertaking. It's great to see the photos of young people at home on their kitchen tables or on their desks doing their remote learning, and at the moment we're still working with the QCAA. As I said, different schools are in different areas as far as examinations go, and so we're working with the QCAA. It will depend on what happens this week, but as the Health Minister and the Chief Health Officer just said, please, if you don't have to leave home, don't, and hopefully we can get out of lockdown from Sunday.
And are there plans being made post-lockdown in terms of how schools will function after that lockdown in terms of mask wearing and the like?
Yeah, look, there's always plans in relation to that. I know the Chief Health Officer looks at this every single day, and I'm sure as we come out of the lockdown, hopefully on Sunday, there'll be further instructions about masks going forward. But as we found, they are a very good way to stop the spread of COVID-19, and it'll be up to the Chief Health Officer's advice about where we go after Sunday. But in schools, clearly we have extended that now to all high schools and adults in schools. In primary schools, I think we're We're going to see how we go after Sunday. There may be some change, but at this stage, primary school students aren't required to wear masks if they're back at school, but everyone else in the school community is required to do so.
So that could potentially extend to younger students, given the spread in the younger age groups?
I'll be guided by the health advice, but whatever the health advice is, we'll implement.
And what's been done to support students who might not have access to a device during remote learning? A recent audit general report found that 14% of kids in disadvantaged areas didn't have one last year.
Yeah, look, that's a good question. With regards to devices, if households require a device, please contact your local school. We'll do what we can to make sure that a device is placed in your hands. And of course, we know that with remote learning, it is always a mix of hard copy and electronic devices and online. With some youngies, it's very hard to do just solely online learning. They do have the materials in front of them as well. But can I encourage anybody who is struggling without a device, and if they require one, please contact your local school and we'll do what we can to have a device in your household as soon as possible.
Thank you so much.
Thank you.